Multidisciplinary team feedback for improving team working is a 3-stage process designed to be owned by teams but supported by trust management.
MDT Fit is an assessment and feedback tool to help teams work together more effectively.
Team members individually assess their working practice anonymously, while an independent observer assesses the team's MDT meeting. A feedback report is then shared with the team and considered in a facilitated team discussion where actions for improvement are agreed, with input from trust management where needed. Actions are then implemented and reviewed over the following months.
Multidisciplinary team working is absolutely critical for cancer care. If you want to get the best care, you've got to get all the professionals who contribute to care working together. We've obviously got to make sure that multidisciplinary teams work as effectively as possible. And that is where we need to assess team function and then hope to improve it in some cases, because almost every team could be better in some ways.
So when I first heard about MDT Fit, I did think, oh, here we go, there's another thing for us to do. But having been through the process, it's extremely helpful to have time to step back and really think about how teams work together.
Well, for cancer patients these days, their care is really structured around the multidisciplinary team, and the decisions about their treatment are made in the multidisciplinary team meetings. So it's really important for patients that those teams are well functioning, because it has such an impact on their treatment, and not just their active treatment but also the long-term effects of that care and the outcome that they receive. And MDT Fit is different to existing tools that teams have to work with, as it really focuses on the aspects of getting those teams to work well together.
It actually gives the teams the opportunity to be able to assess how they're actually managing a patient's pathway.
One of the best things about MDT Fit is it's not a process that is done to you, it is something that enables you to do for yourself.
The whole process is intended to be developmental, not judgmental. It's most important to say that we are looking both for the positives on which we can build as well as on any negatives which people can then say, okay, let's take action on that. We can look at good practice, can observe good practice and then spread that across the country as well.
Having the evidence from a tool like this is really powerful, not only for the organisation to get that real bottom-up view of things they need to work on, but also for us as a system looking at the factors which are influencing MDTs across a number of organisations, so that we can understand how we can bring teams together to resolve those, which will be much more sustainable in helping them be more effective in the future.
You'd be surprised at the number of things that need to be changed because you didn't notice them, and there are other things that you will want to change because they bother you and you feel you have another opportunity to err. And MDT Fit does give you that opportunity. We were able to, within a remarkably short space of time, deal with a lot of issues that festered under the surface which people didn't realise were festering.
I'm delighted with the progress that has been made with MDT Fit.
I found the whole process very, very helpful to streamline the MDT.
If we can get teams really thinking about how they work together and working more effectively, patient care will always improve.
The most important thing is that we owe it to patients to make sure that the team is as functional as possible.
You get out what you put in, and the more you engage with it, the more you'll get out. So do it with gusto and you'll get a whole lot out of it in the end.